about the role of the practice nurse. So could you just tell us a little bit about what is your job role, please?
Yeah, sure. I'm a practice nurse. I've been a practice nurse for 5 years and I work at University Health here in Sheffield. So we look after students and their families.
Fantastic. And just would you tell me a little bit about what a practice nurse actually does?
Yes, I suppose most practice nurse appointments are sort of planned appointments. We're not tend to seeing things which are urgent on the day, although occasionally that arises. So a lot of our appointments will be long-term condition reviews. So for instance, this morning I've done seen a lot of patients who've got asthma, which tends to be the long-term condition we see in our younger people. And so that will be an annual review just to check that they're okay with their medications, that their symptoms are well controlled, and find out how they're doing. And most of those appointments will involve a lot of health promotion and patient education. And then there can be appointments around wound care, for instance, a lot of chronic wound care, particularly in normal general practice. By that I mean the mainstream general practice, not looking after students, but all ages. There'll be a lot of chronic wound care there. Ears, so people's having their ears looked at, possibly irrigated. A big part of the practice nurse role is around contraception and sexual health. So I see a lot of patients for discussions around contraception. Also doing cervical cytology, which is a screening test to prevent cervical cancer. And then immunisation, that's a huge part of my role. So ensuring people are up to date with their universal vaccinations, the childhood programme and the older adult ones. But then also there might be, if someone's had a needle stick injury or a rabies exposure, I'd be giving them an immunisation for that.
Great, that's really useful. It's really helpful to know. And so how does your role integrate with the wider team within your practice?
So I would see a lot of patients might come to me, for instance, after they've been diagnosed with high blood pressure, and the GP wants them to come for me. Perhaps they're titrating them up on a medication, so getting them stabilised on the suitable level of medication. Again, that would probably involve a lot of patient education and health promotion. Again, that long-term condition management thing, so getting people stabilised and managing their condition as best they can. So that might be where a GP is referring to us. It tends to be that that nurses run the asthma and COPD and things like that, and we'll refer to our medical colleagues when we follow the guidelines and we're not quite sure what to do after that. And we might refer on to someone like a social prescriber. So, for instance, if I identified a patient was particularly socially isolated, lonely, or needed some advice around debt or that sort of thing, quite often in their practice, that role is taken on by the social prescriber. And then, we might just have people booked in for they need a bloods doing, or yeah, that sort of thing. So we might refer on to other people within the practice, and then patients are getting sent to us for sort of long-term condition care.
Okay, thanks ever so much. I think that's about it. Just a quick snippet of what it's like to be a practice nurse. So thank you and nice to see you.